physician should be. And second one is medicines. Third one is patient.
Oh, I'm curious on the fourth one.
And fourth one is bystander. Bystander. One who supports these medicines. Bystander. So these are in Ayurvedic way. There should be 4 limbs for a treatment. 4 limbs, 4 divisions. 4 things are needed for treatment. So you study, you become a physician. So in order to practice it in Germany, we should have second one, that is medicine. Availability of medicine is very important. Third one, patient you can get everywhere, no problem. Bystander also, one who helps the patient, he also will be available. So you are facing a problem in Germany that these medicines may not be available. So how can, as the coordinator of this course, we teach you something? You should be able to, in a little way, you should be able to practice Ayurveda. So I have seen many patients I have seen many physicians who have learned Ayurveda in Greece. He is called as Kostopolis. He used to come here. So we had discussion, and he took some of the simple remedies in many diseases, and he listed it out, and we exported the medicines to Greece, and he is a neurologist in Greece. He is practicing in the way of Ayurveda these Ayurvedic medicines. Very simple medicines. There are many companies which export the medicines for Western countries and also these Arabian countries, etc. There will be, for example, Himalaya pharmacy. It has got very good. You can have sometimes these kashayams, kwathas, kashayam. You know kashayams. That will be difficult to export, and it will be difficult for taking. So they make it, even Ayurveda, there is a company in Madurai, they make everything as tablets, so that it is easy to take, it's palatable. So there are scope for treating Ayurveda in Germany also. You can make it available, these drugs we can make it available. See, in almost all the areas of Western countries, Settling, there's a tablet by Himalaya. It's widely used, Settling. Many things are like that. These things are used by these Kostopolis in Greece, and he very nicely takes the case, find out which of the doshas are increased and how we can make the dosha in the normal level and make it palatable also the medicines he is practicing. So I had a conversation with him, and I am thinking about making the treatment available in Germany. We can help you, whatever you want. Last time when Dr. Shyalkumar and Dr. Ram came, we went to Ayurvedishala to discuss with these possibilities with the general manager.
Hubertus Seel. This was a guy who has a shop in Germany. He is already exporting drugs from here to Germany. And he has quite a list actually. And there are some available.
But he has not all.
No, he has not. But also, all is also probably the demand is not there. So if he orders a lot, then we have to slow a lot. When So we could have more if the demand would be high. So that is also something that is, you know, if the demand is high, you can import more. So it's like a stepwise approach. Yeah?
We should be able to practice it. If one medicine is available, we can utilize in several conditions of the disease, several diseases also. So we have to specify in which condition of this disease, these medicines will be useful. See, I shall tell you one example. There are some of the medicines prescribed in Ayurveda in fever. They are not used in fever. They are used in the several conditions of the condition prevailing in fever will be same in some other disease also. So we are identifying the disease condition. Whether the disease may be different, but the condition of doshas, increase, decrease, everything will be same. So this medicine can be utilized in another disease also.
That's actually also the way HCL told us.
Yeah.
But of course, the selection of doshas and so was not, I mean, comprehensive. So we still have to learn a lot and really to see what's going on. But that's a little bit the way you already does it.
Okay, we are limited now. No, we are still in our thinking.
Limited knowledge, everybody has limited knowledge. We are that we know more. Because this world is so wide, science is so wide, the ocean is very big. Knowledge ocean is very big. So we are knowing only little. Within that little limit, we should be able to practice it. That's what I know. We will be having little medicines, little knowledge. Okay. In that little knowledge and little medicines, effectively we have to manage. Why? Because after you go here, you get a disease. And with your limited knowledge and limited medicines, if we are able to give some relief for the patient, our science will get a boosting. And we will be confident that if such conditions come, I will be able to treat successively in this condition. So at least even one case, one disease, one condition, if you can improve, that will be a boosting for the science and also for your knowledge, your practice. So at least something you should gain from the practice also, the knowledge. So when you give some medicines, you will get a faith, confidence in that science. At least you should experience it. That's what I was telling.
But I'm doing a little study now with a part of the part with polyneuropathy patients from chemotherapy and from diabetes. And I have seven patients already done, and I recognize that only those patients improve when they change their food lifestyle. And they always say the Abhyanga is very nice, and the 1 hour lying with a sheet over the legs is very nice, and they can relax, and that is very improving for their soul. But if they don't follow the food advice from me, after 4 weeks of not Abhyanga, if I do just 10 Abhyangas and then I stop for the study, the old problems will return. So not only the Abhyanga with Kshira, Bala or Pindatailam will improve their condition, but the food changing habits will manifest or will harden the outcome.
What you told is very correct. Hippocrates told that let food be thy medicine. And also in Ayurveda also we say ahara sambhavam vastuscha ahara sambhavam. The body is made from food only. So how you are taking the food, which type of food, accordingly our body and mind also changes. So food So we, in Ayurveda, our concept is a holistic approach. That is why health comes from three factors: one from exercises, one from food, one from sleep. So this normalcy we have to keep. These three, you have to correct the sleep, you have to correct the food, you have to correct the exercises. Maintaining that, we are doing the treatment. This is basic. This is foundation. From the foundation, we are thinking of medicine. So medicine, not only the medicine works, while you are correcting the lifestyle like that, and plus medicine, that will be acting in the disease or the patient. So that's very important.
May I lead this discussion a little bit to other? Availability of medicines which come from here is probably very important and will become more important. The other thing which we have to discuss also the last time is that we need to classify drugs, plants, or drugs out of plants which are originating in our environment. And in order to learn where there are analogies that we can use, analogies to plants that are growing here, that we can use in Germany or in Europe in a general matter. So that would be really, I think, a very interesting project. If we take...
According to Charakacharya, he says, whatever disease originates in a land, there will be medicine also available in that land. If you are getting a disease in Germany, Duisburg, when you get a disease, there will be medicine herbs available in that area which can be utilized in that disease. So we have to identify these medicines, these herbs, and what are the herbs available and how it can be used in several conditions of the disease. This study you have to conduct. Otherwise what happens, in India there may be many herbs. You have to always export from India or import to Germany. Better than that, we can have a knowledge of what are the drugs available in your area so that you can use it very easily. Then we have to, so this is a project, what you told is a project we can do.
That would be an interesting project.
Why? Because he thinks that this medicine will relieve my disease.
30%.
It's a study. You can switch on to the internet and see. Placebo has the same effect as medicine. So we thought about it, how it becomes like that. Because that is why Ayurveda tells Raga the Roga. Roga is the end result and Raga is the origin. When you have mental disturbances, it may result in disease. So where we have to, the disease may be in the body, but the origin may be in the mind. So you have to treat in the mind. So placebo, how it affects it is, placebo corrects the mental correction it does. That I am taking a medicine, this will be very effective. So it gets relief in the body also. So man is not just a physical body. It's not just a physical body. It has got, and according to yoga, man is a being of 5 koshas, 5. And physical body is Annamaya kosha. Have you studied this? Pranamaya, Annamaya, Pranamaya, Manomaya, Vijnanamaya, Anandamaya. So we are not only this physical body, we are other levels of our entity also are there. That is Pranamaya, mind, Manomaya, knowledge and also Anandamaya blissful state. So we are making a patient upgrading all these things. From the Annamaya Kosha, we are going to the perfect health means bliss. And face is the mirror of our mind. Face shows how we are. Is it? So, a depressed patient, when he comes like that, we can identify that disease comes from. In such cases, these, it will be, placebo will be having effect. While a case, the disease originates in the Annamaya Kosha or only in the physical, it will not give a relief.
But
it will not be.
If I can say, I assisted to a very beautiful presentation of some leading European neuroscientists. They were even showing pain patients to get probably very emotional too, and with PET, PET or MRI, I think PET, with PET CT scan of the brain after injection of water, but the patient does not know. Then the areas of the brain which are get stimulated from opioids, the opioid receptors get activated from endorphins, which the brain is released, thinking it's getting external opioids, and so the rate of respondence is very, very high. Even an injection of water produces a lowering of pain, which the pain of such a huge, and there is a great discussion right now, because the majority of patients do respond and the minority do not. So there is a non-responders to placebo, which is now getting very interesting by itself, but it's a biological Annamaya Kosha process, which is taking over immediately after placebo administration.
Did they say to the patient what they...
It can be very much utilized in some of the diseases. Small medicines are available, very small medicines. You can show wonderful results. There is no need of many medicines. Just one medicine will be effective. Those who can aim in a fixed point and put the arrow there, it will be effective. Even who has not the capability of doing it, he will need so many arrows. Still, it cannot hit the correct point. So we have to find out which medicine will hit the target. That we have to. Even it may be sometimes the food also will become medicine. Food, I have seen many cases, gastritis cases, spinal gastritis cases, etc. Many cases come. Just you simply change the diet pattern. It will give you. Even though you prescribe many medicines, it will not give any effect. I used to tell the patients, you don't take spicy things, that everybody knows, and advise them positively also. What you can take, food you can take, rice you can take, because the people here take rice you can take, and with carrot or beetroot, all this can be cut into pieces and make a dish. Some oil, coconut oil can be put, and you take as much as rice, that much vegetable you can take. I have seen that many of the cases it subsides gastritis. They make it a habit also taking, no problem. Otherwise, some of the cases they have to go for endoscopy and surgery, etc. can be relieved with a simple change in the pattern of food. Even you can see our PK Vaidya, Ayurveda, he used to tell in the cases of hyperlipidemia, take the food, don't take food after the sunset. This was the advice he used to tell. Because the criteria behind this, if you take food after night etc., it doesn't get digested in the body. So what happens, ama, undigested food substance will be increasing in the body, and it only increases the lipid in the food in the body, or cholesterol in the body. So we tried this. We used to tell the patients, don't take food after sunset. And what happened, just without any medicines, this lipid or the fat or the cholesterol decreases. It was, I know the case, he is practicing in a dentist, modern dentist. He is practicing in nearby area. He was taken to PK Vaidya and he advised it. And what in Ayurveda is Shaguna Ashanata. This is the treatment for this. Shaguna Ashanata means bird. Ashana means food. You have to take food according to the way a bird takes. Bird will not take food in the night. It will go to after sunset. It will not take any food. So like that, we also should. When we take food, if we don't take the food after sunset, certainly cholesterol will decrease.
Also when sunset is at 4 p.m.
You are maybe different. So then also, so when the sunrise will be there?
7.
Sunrise is not, no.
7 in the morning.
No, sunrise is not at 7 when sunset is at 4 p.m. It's later.
It's just
that means that there should be ample time for digesting this food material. That's the criteria behind it. See, here, your area that sunset, sunrise also, there will be no sunrise at sometimes some it will be there. So that differs. That you have to your common sense how to practically make this possible. It's not here it is like that. Then if we take food before sunset, next that will be 7 o'clock or something. Next day he will be taking only 7 or 8 o'clock. That means 12 hours are there for the food to digest. So that when the digestion, after digestion also, food digestion also, the ama will be digested by these 3 or 4 hours. So that everything will be okay. So this is the pattern of life we should have. Even I have experience. There was a man from Chapati, he is called. He has a site called Awake and Bake. AWAKE Bake. B-A.
Awake and Bake.
Awake and Bake. That site, you can see, he is called Chapati. He likes Chapati or something. Some other name is there. So he had come to our house. 2 or 3 days he stayed there. And when after the sunset, we gave meals to him, he told me, I don't take food after sunset. Then I asked why. We are trained like that, not to get diseases. I appreciated it. Though he is from US, he knows the theory of long living, longevity. This is longevity. And we say, one time food, we used to take 3 times food. one-time food is yogi. Yogi. 2 times when you take, you become bhogi. Bhogi means one who enjoys. And when you take 3 times food, you are yogi.
This is the drunk
So this is the concept. You understood? Yogi means disease. One time is yogi, 2 times is bhogi, and 3 times is yogi. Yogi means patient. So we cannot make a man happy without changing his lifestyle. In that condition, ignorance is the disease and knowledge is the medicine. So we have to educate the patient how to live in longevity. What are the basic principles of health? What are the basic principles of disease? This you have to educate. And Vaidya is called a knowledgeable person, knowledgeable about all the areas of life. And Ayurveda is science of life. There are several things which makes a man disease. You have to find out in this patient in which area he is weak, which produces disease, and target it that time and correct it. Everything will be okay. If we don't know this area from where the disease originates, you give many medicines and it will be futile. And by the medicines also you get other diseases. This is what happens. Hospitals are increasing and patients also are increasing. If the hospitals are effective, patients should decrease. So we are keeping the condition in patient condition only. When he starts a disease, he is yogi all the time. He is diseased all the time. This is what is happening. Why? Because we are not going into the details of the origin of the disease and finding out and removing it.
But I think the most people in Germany, a lot of people, they are so in their mind, a tamas mind, because they don't want to change their lifestyle, and they are so at ease with their junk food and habits of life. And if you say change your life, change your food management, change your exercises, then they tell me, oh, what am I to do? I will lose everything when I change. They think they lose their quality of life when they change. And I have to give them the new option of thinking that they gain quality of life by changing their lifestyle. But it's not so easy. They are so in habit with their lifestyle, and they say, I can't change my work. I can't change. I can't. And then I say, why don't you try? Then my wife will get divorced, or my children won't love me, and I can't change. They are just blocked in their mind.
See, destiny is what we are creating.
Yeah.
If one man is destined to have suicide, we can somehow block him. But we should give knowledge to him so that he becomes practical.
Yeah.
See, I shall tell you. From Germany itself, my daughter is living there. She was doing thesis. All the time she was working. And she doesn't like to cook also. Sometimes she may not take food, work. And she became workaholic. She has got a project. She is working for them. Side by side she was doing MS. So what happened, maybe tension also, she got hyperacidity, gastritis, and she was suffering. And what happened? She went to a modern doctor. He gave some medicines. Not at all getting relief. Then she, after all trying all these things, she told me, Father, can you somehow help me? I'm in this condition. I took modern medicine. See, I shall tell you. I told you, life has 3 pillars. In three pillars only life is sustaining. The pillar 1 is food, second is exercise, and third is sleep. You have to do all these 3 things perfectly. I shall advise. And I advise you how this can be managed. And I shall give you for the medicines or already the disease has occurred. And I packed the medicines from here and gave it. There was one who is practicing in Holland, Netherlands. He's MU. She used to come here and we used to take classes for her students. She is somehow treating everything well. So she was here last 1 month ago, and when she was going, I packed the medicines and gave it. Now, after that, until I got here, she was perfectly okay. I am doing exercise now. I am doing exercise, I have good sleep, I am taking full food also, no problem. So this we can also do. If you try to change the mind of the patient, that we have to do. It's not for us, it's not for him only, for his longevity. He should find out that what we are telling is for him, that he should have Charaka, the philosopher and also physician of Ayurveda, the greatest physician in the world is Charaka. Charaka, you know? Charaka tells, Antaratmanam pravishya, Roginaha Antaratmanam pravishya, Yaha Chikilsadi, Saha Chikilsadi. One who enters the heart of the patient, the physician who enters the heart of the patient and treats, he only correctly treats the patient. So we have to know the heart, the mind of the patient and correct it. That we have to do. He should have faith in us. Then half of the disease will be removed. And if he has no faith, whatever the antibiotics you give, it will not be effective. So that faith healing is very important. Even there was a research study that placebo is not, we say it is not no positive, no negative placebo. But a study in the US revealed that placebo has very good effect. As the medicine in one disease, in Vadika conditions, you can prescribe this. Paithika conditions, you can prescribe this. That you have to identify.
Yes.
If it is Vadika, if a diarrhea in Germany comes, you have to identify this is Vadika diarrhea. This is Paithika diarrhea. This is Kaphaja diarrhea. That you have to identify. Then you take, we will give you a medicine start that will be effective in Vadika. This will be Paithika or Kaphaja.
But it can change in the
course of time.
In the course of time.
Yeah. And then we have to change the medicines also. You see, for example,
Yeah, of course.
diabetes.
The first time
Who is
I got
diabetes specialist?
she's
Okay.
So you see, in the first time I got Ivara. In the second day, it was gone. I had no abnormal temperature.
Yeah.
So I had to change.
Certainly we have to change. Even the diabetes, they say, diabetes, some of the diabetes starts with the kapha, middle it will be pitta, and last it becomes vadika. See, we see it in the patient also. It's not a theoretical thing.
Yeah.
See, where diabetes starts with kabaja and ends with, because diabetes, when it prolongs, we see diabetic neuritis. That's a condition of changing the diabetes into a Vadiga disorder. So in such conditions, you have to give, for neuritis, we have to give such Vadakna, or which decreases the Vada. While in diabetes, which is the onset is 1 or 2 months, you can see, it will be Kaphaja and Kapha Lakshanas will be there. When you treat it with decreasing Kapha, it will give result. So that differs. Even one disease may change. That's the duty of the physician to find out. Whenever it changes, you have to change your medicines.
Yeah.
There is no such medicines which is available for one disease. It is not under the criteria of Ayurveda. We have to see the conditions. Even Acharya tells that Vasti, Vamana, Virechana are Panchakarmas. They say about indications and contraindications.
Yes.
And he tells how much he has thought about it. He is telling, see, I told you indications and contraindications. Okay. There are some conditions, contraindicated conditions, with some of the medicines you can use. Then in indicated conditions, there are some conditions where you cannot do also.
Yeah.
So this you have to find out. I cannot tell these full conditions. I can tell only a knowledge. You yourself have to find out from your knowledge which are these conditions where it can be done and which cannot be done. Then, and Shastra or science is a light only. A light. You have to open your eyes also. And you are closing your eye and telling, I cannot see the light. It's futile.
That's it.
So that is very important. So we can have some of the medicines available and you have to think over it and the quality of medicines. And accordingly, in the disease conditions, you have to find out which is Vata, Vata. You can utilize this medicine. And he says,
use your brain.
and Acharya says, you cannot study a subject without classifications. That's correct, is it? And you cannot study a subject with lacks of classifications. You cannot finish it. So there should be a classification. There are some of the things which are out of classification. That also will be there. Always you have to ponder upon it. Always you have to think over it. So thought cannot be provided from the text. Thought you have to come your that cannot be fully given by the text. So that's very important. Elgaji, am I correct? Yeah. So with the knowledge we have, with the medicines we have, how we can utilize it for a suffering patient in your area. That's what I was thinking. So you give me suggestions, I can, or within you can give suggestions, we can apply it, and how it can be made practical, you can think of. Am I correct?
Perfect.
Yes.
That would be
Probably
great.
also another.
Otherwise, just the knowledge.
Probably also.
Knowledge will not be some effective. We have to, at least for some, unless we study something. Your daughter is there, your son is there. he gets some complaint. We should be able to give some relief for the patient by Ayurvedic medicine. See, I took a class for my experiences. My son was having appendicitis. I did not take class for this test. I did my clinical experiences. You were there, is it? No,
No, I wasn't.
He was there.
Exactly.
So, my son got an appendicitis. And he was suffering with the pain, and I was not there at that time. Then he was taken into a hospital nearby by my wife. So when I came in the night, he took the medicines and he got allergy. And his face was swollen, everything. Then I took him, he had the anti-allergic things, had scanning and found out that he has got appendicitis. So the doctors in that hospital, modern hospital, they told you have to undergo surgery. Now it's otherwise it will be no good. So from my clinical practice, I had treated many appendicitis cases of children. So I was sure that I can manage it. So I told him, they are doctors are my friends only. And I told them, I have got experience and I have got faith in Ayurveda, and in the condition also I can accept. It's not so much acute condition to get operated. I can manage it. I am discharging the patient. So they told me, it's not good. You can take your decision. And I took him and came to my house. Gave Ayurvedic medicines. Medicines I used was kashaya is called Kaideria kashaya. Kaideria means curry, one leaf we put. Sambar, etc. one leaf will be put. That is called curry something. Curry leaf.
Curry leaf.
Yes, curry leaf. That is the main ingredient of that medicine. And I gave it. And after 15 days, he was very okay. No pain, everything subsided. He was going to the school, no problem at all. And one day, that doctor who was treating for appendicitis, he called me and asked me, what happened to your son? He's okay, he's going to school. It's I also hear that Ayurvedic medicines were very effective, is it? Yes, yes. So I want to tell you, my son-in-law has got appendicitis. I shall bring him tomorrow.
It's nice.
That's from my experience. This was something happened. Because I had that experience, I can firmly tell that I can treat with Ayurvedic medicine.
Oh, we have a lot of
This
children.
faith we should have. This faith we should have.
We have a lot of children with appendicitis.
Oh, they get operations.
And I'm looking, because as an anesthesiologist, I do the anesthesia, and when I look over the sheets and I see there is nothing with the appendix, and they took them out because once they are looking into the abdomen, they take it out. Of all of it.
So,
because otherwise it would be a nonsense operation.
And there is, you know,
Gott sei Dank belassen die Gallen noch.
you know jackfruit. Jackfruit. You know jackfruit.
Jackfruit.
Have you eaten it?
Yes.
Yes.
Jackfruit. We eat it. Okay. We don't know the clinical conditions where a jackfruit leaf can be used. We don't know. We don't know. But they are medicines. If we have no knowledge, everything is non-medicinal. If you have knowledge, everything is medicine.
Yeah, okay, that's it.
And Acharya Charaka, he was studying with Guru, Jivaka. He is called Jivaka, a student of Ayurveda. He was studying, he was living in the Buddha period. Buddha, you know. He was a famous physician. He was studying, and after studies, this Acharya comes and tells the students, okay, you have studied everything. I am doing an examination for you. All of you can go outside and find out a thing which is not at all medicine. All of them went. They collected many things and gave to the Guru. These are not medicines. Jivaka went outside. He roamed around and returned back and told the Guru, I cannot see anything which is not medicine. Sorry. The Guru told, you are the only physician, I will give certificate for you. So like that, this has happened for us, me also. I shall tell you an example. I was reading a book. So, hiccup, for the hiccup, it is written in that you can use the leaf of jackfruit, you can boil it. Jackfruit can be put into it and boil that water and you give it to the patient. Hiccup will be relieved. So I thought, this is not at all medicines I have known, even it is not in the other texts. Then I shall try. And then there a case came for me. He was having for the last 2 weeks hiccup. So I was reading this book, and I had to present a seminar. So at that time, I took these things. I asked him to take jackfruit leaf, boil it, and take that medicine. Intermittently, just you can take. Then what happened, after 3 days, his wife told me, hiccup has stopped. He is very peaceful now. Then I wondered, what a wonderful result it shows. Then what happened, my student, he was PG student, Manoj, he is called Manoj Sharma. After 1 month, he was asking me, he was doing PG at that time in Trivandrum. He was telling he is going to a modern medical hospital. His professor's son has got hiccup. And I heard from your speech in that this can be used, can we utilize it? So I told you tell him, it's really available, no money needed, also you try it. Then what happened, he advised me this and the medical college, modern medical college professor's son, he took it and after 4 days he was relieved. Then the student called me and told me that professor was telling, is there such effective medicine, sudden relief, which gives sudden relief in Ayurveda? He was asking. So that is that is giving name for Ayurveda also. Such medicinal. So there are, as I was telling, there are some medicines which has got special action in special diseases. Other than the dosha concept also, some of the medicines are special effect in some of the diseases. So we should go through the text and find out. But that needs a very good work.
Yeah.
What are the herbs available in your land and classify it and it's Virya, Vipaka, Rasa, everything have to be identified, and we have to find out whether it will be utilized in some of the diseases that we have to weigh. And Ayurveda tells we have to find out the qualities, its gunas and everything from the people who are living in that area, who are using these medicines. We have to get knowledge from them, what are the qualities of these medicines. Because we have, in forest area, there are people living it. Nobody comes to our land by a snake bite. There are snakes, but in the forest area, the Adivasis, they are living there. They know some of the medicines which are utilized for snake bite. They know the medicine also. We don't know what is this medicine and what they are using, but they don't come to the villages for treatment. They have their medicines. So that's a traditional way of medicine. Medicines available there. So we have to get the knowledge from them. So that is why Charaka tells you have to get the knowledge from the people who are living with these herbals. Even there is a man, you may be, sometimes you will get that knowledge from internet. In Chinese, Qi Liu or something, his name is. He was a man who is collecting the herbs from the forest area and giving it to the Chinese acupuncture, Chinese system of medicines. He was collecting the medicines and giving it. So what he did was, he used to take these medicines internally. Every day he will take some of the medicines, what he is collecting and giving into the Vaidyas, the physicians there. So, what happened, the WHO had studied about him. He lived for 250 years, 256 years. And they studied him and found out that these medicines had a action of mutation of the cells, changing the cells, that genetically mutation gets, and his longevity is due to these herbal medicines. This knowledge we don't have. So we have to connect this knowledge from them and get it. And there is one medicine now available as Jeevani. Jeevani it is called. Jeevani is a type of medicine that was collected from the forest people. Forest people, even though they don't have food for 3 or 4 days, they take a type of medicine that gives energy for them. Just chewing some of the leaves, they walk, everything they do. And this TGBRA, Traditional Botanical Garden in Kerala and Trivandrum, they studied about this and found out what the medicines are, and they are marketing it now as in the name of Jeevani. So there are many knowledges which are hidden in the pupil. We think that we are the knowledgeable person. They have traditional knowledge about it. We don't know. Even you went there, Gangadharan Vaidya, you went there, some pediatrician, an old man. His family has got a knowledge about Ayurvedic pediatrics, how to treat everything. That knowledge a modern physician in Ayurveda will not have, because he has collected by the tradition. So we have to return into the traditions. Even there are some of the local LSPSs and also some of the associations, they do study about it. Traditional and village area, how the Vaidyas or physicians treat, what are the medicines they use, and study about it in the way. So this is very, very much essential for getting the knowledge of treatment in Ayurveda. So even in your area, I don't know, in Germany or Duisburg or area, is there any herbal people we have to find out what are the herbs they were using, so that if they get successful treatment, you can get the knowledge. Ado Bhadraha Kalavo Induvishada, that's a mantra from Rigveda. It says that let all the knowledge come from all the directions. So we think we are great physicians, but knowledge will be there even in a child. He will have some child. If we can assimilate it, we can get that knowledge, it will be very much effective for us. So that is there, certainly that is there. So we have to find out. Even I can tell Ayurveda to get some of the, we can identify some of the diseases which are, you can identify in your area, what are the diseases coming.
So we have a lot
what are the simple remedies we can utilize in Ayurvedic way in such diseases conditions.
Yeah.
If you can find out or tell what are the diseases more coming in your area, we can have a discussion and find out some of the simple solutions, simple medicines which we can promote them.
That's good.
We think about it.
We could give you these lists of medicine, and we could select maybe, I don't know, maybe 10, 10, 10 or something like that. So
that can be done. Medicines we can list out.
That would be great.
That will be done. That we shall give you. But you have to identify.
We maybe might need 15 minutes. We can do it in 15 minutes.
Yeah, you do it. You give me. You give me now itself.
Yeah.
Let it be done now itself.
Yeah.
We shall then, if you give it, we shall select some of the drugs which can be given easily available, make it available in your area, your Duisburg, you can utilize it.
Shall we do it now or later on?
Yeah.
What's the...
Or anyway, you can decide. No problem.
Hast du die therapeutische Liste auf dem PC?
Yeah.
If you
We have a script with a therapeutical list. And the list from Hubertus Seele, which we can...
The question now is completely different. The question is, would you like to write down 15 quickly the most common diseases?
The common diseases, I should not name the diseases. I learned I should not name the diseases.
That's
I should name the symptoms. And we have a lot of Vata Pitta symptoms.
that I shall tell you how it is. Even Ayurveda tells about disease conditions, doshas and such. But they classify into diseases also. There will be a disease and symptom. You have to find out, is it due to Vata, Pitta or Kapha? Or it's two diseases can combine. The combinations also we have to find out. And we are deciding in which disease, which combination of doshas are there. This is what we are doing assessing. So, disease also is there. See, there is fever is there. There are different conditions, and hemorrhage may be there, hemophilia may be there, or some cancerous diseases are there. There are some medicines which will be active in some disease conditions. There are specific, not only dosha, there will be some of the medicines which are effective in some of the diseases. Why? Because that depends upon which of the dhatu is involved. See, I shall tell you, obesity. obesity is a condition which the Medo Dhatu Agni, there is an Agni, Agni means fire, that converts Medas or adipose tissue and converts it into next Dhatu, that is Asti or bone. That's a Ayurvedic concept. So, when there is a obesity occurring in a body, what we are doing is we are making or we are increasing the Agni or fire of the Medo Dhatu Agni, that is called, that Agni is corrected. For some of the drugs which act mainly on the Medo Dhatu Agni are available. That has a specific action. See, like that. Vacha.
Yes, yes, we know. Vacha.
Vacha has got main action in the brain cells. Brain cells. It is given for memory, etc. We are giving it. So, it has got, though it has got action in the doshas, it has got a special action in the some of the areas of body. That, see, there is Punarnava. You know, Punarnava diffuser. That is available always. It has got a special action in the urinary tract. Though it is the doshagna, okay, there may be action of in the doshas. There are some of the medicines which have got a special action in some of the diseases. Adathoda vasica. It's a drug. Adathoda vasica. Vasha it is called. Vasha is called as Adathoda vasica. Vasha has got a special action in the respiratory tract. This Vasha Adishta is given in the conditions of dyspnea, all these conditions. When you have breathing problem, etc., it is given. And it has got a special action in the conditions of hemorrhage, hemophilia, etc. So, Acharya tells, Vrisha Sadhyo Jayatyasya Sahyasya Paramosha. Vrisha means Adathoda vasica or Vasha. Vasha has got, you have to understand that Vasha or Adathoda vasica is special action in the conditions of hematuria or hemophilia. So, drugs are there which have got a special action in some of the diseases. Not only those doshas, we have to find out some of the drugs which has got special action in some of and also Gochuda. Gochuda has got a special action in urinary. It's diuretic. Even though you tell about Rasa, Vidya, Vibhaga, everything, some of the drugs has got Prabhava. You have studied Prabhava means special action. Some of the drugs has a special action in some of the areas, some of the organs, some of the systems. It has got special action. So that we have to find out. That also is important in treatment. So Varana in obesity, Varana the Kashaya. Varana is a type of drug. I don't remember the terminology. Varana has got a special action in the Vedas, Medo Dhatu. So that is why in Adisthaulya or obesity, we are giving Varanati Kashaya. So Kashaya or tablets also available. When you take, the obesity decreases. It increases Agni, general Agni, but it has got special action in the Medo Dhatu Agni. Are you understanding what I tell? So there are drugs which have got a special action in special systems or area. So accordingly, that's why I told disease you have to find out. And this, for one disease, not one medicine.
No.
For a disease that you will tell sometimes, okay, diarrhea. You shall take a diarrhea case. Diarrhea case, there are special conditions. There may be Vadika, it may be due to Vata, it may be due to Pitta, it may be due to Kapha. The medicines in these conditions are not the same. disease may originate from, a diarrhea can originate from the disturbance of mind. So we have to give Vada, we have to find out which will decrease the Vada activity, neurological. Maybe a neurological disorder may be causing the diarrhea. In such conditions, you have to give medicines which will alleviate Vada. So sometimes a condition may be Pitta will be activated. In the cases of sometimes gastritis, etc., Pitta will be increased. So you have to give which will decrease the Pitta. Sometimes Kapha will be increasing and it may cause the a decrease of Agni. In such conditions, you have to give the medicines which decreases the Kapha and increases the Agni. So these conditions we can address. First we have to know what are the prevalence or type of diseases occurring in your area. They decreased into now 200 and below 200, etc. And why this is decreased? There are two things. It may not cardiac problems, etc. will not be there when it is decreasing. Another version is that companies can sell
more medicine.
anti-lipid medicines more if this criteria is decreased.
That is economic part of it.
So see, these atorvastatin, etc. is hardest effect it has got in liver cells. Still they are prescribing it, even 2 to most of the people will be having, it says, 200 to 250, almost people will be having lipid or fat, this cholesterol. So they also should come in for the medicine. For that companies make it like that. So that is there. Even in there is a story in ayurveda that one Vaidya, that's an interesting story. One senior physician was called. He used to treat the patients, and many patients come, give medicines for 1 month, and after 1 month, the patient will be coming and taking medicines. And once what happened, when the senior physician was not there, and another junior physician was there, he was called as mad physician. Why? Because he doesn't used to treat at that. So when the senior physician was not there, one patient came, and this junior physician, he made some medicines and gave it. So he went away, that patient went away. And normally every month this patient used to come. So the senior physician asked, when next month this patient is not coming, he asked, what happened? That patient used to come and give money for us. He is not coming this month. Then after 6 months, this patient came and he was coming to see the junior physician. Then and with some of the things he came and gave money, everything to junior physician. And after that he went away. Then the senior physician asked, what happened? What did you do? Then he told, I gave some special medicines for him. He is not getting any disease symptoms now. Everything is relieved. So senior physician was telling, that's why people call you mad physician. I also know that medicines. If I give that medicines, he will not come here at all. We want to get that money every month. For that only I am giving this medicine. When he stops that medicine, he will come here. Now he will not come at all. This is the way of treatment now happening. This is the way of treatment happening. Every month he has to give. Every time, see, when you start anti-lipidic medicines or hypertension, diabetes, or cholesterol increase, you have to continuously do all the lifetime. Has anybody stopped it? No. Has anybody changed his lifestyle and stopped it? This is, so what is in medicine means, these are not the medicines. We have to change his lifestyle, then only it will come to decrease.
They just changed the limits for the hypertension.
Yeah. Keeping it on the medicine, keeping them on the medicine, not away from the medicine.
So millions of people now are hypertensive people just because they changed the limits.
But if I can say something as an allopathic doctor, first, allopathic medicine is very young. It's barely 100 years old, more or less. So first antibiotics were developed under World War I condition, and modern pharmacology is still quite a young science. Like the most interesting medicines are the product of the last 70 years. And from a probably Ayurvedic perspective, we just went for the karma of each substance, and we isolated it from the plant. For example, opioid flowers are interesting because of morphine, and we got morphine out of the opioid flowers. Or aspirin comes from particular tree's bark, and we stopped using the bark, we just isolated the aspirin. And there are plenty of such instances from natural, original penicillin itself is a mushroom. It's a type of mushroom. And so I think that we're still on a very early stage of allopathic medicine, despite all the lacking aspects. Is still breaking through a scientific concept, and I think it's every time quite reassuring to go back to have a kind of structured workflow. There is a diagnosis and an OPS, operation standard procedures to follow, and it's very narrow, but at the same time very clean. It do not strive too much.
That's very correct.
And probably actually this was what I wanted to say.
See, this active ingredient and the whole substance giving is different. See, Serpina, it is from Sappagantha, but we give it as a holistic, not the active ingredient, as the drug we give, it has not got no side effects. While Serpina, when it is taken as active ingredient, it gives side effects. So that is why the kashayas, etc. We don't give it an active ingredient so that they take all this essence. And medicine, we could have discussed about it. Medicine, how it becomes effective. There are 64 herbs involved in a Chavanaprasha drug. 64. So what is the criteria of mixing this? How it made into a form of that Chavanaprasha in a Leha type? How it is made? What is the criteria there is? We studied about it and found out that there are two types. Samudaya Prabhava and Avayava Prabhava. Avayava Prabhava means one medicine will have one effect. And when you mix 2 or 3 medicines, you can count the quality of these 3 and find out the result of it. Some of the medicines, it will not be like that. Some of the medicines, they may be opposite or sometimes different, and what they are joined will not give the effect as decided. It will be having some other effect. So, you see, we say ghee and honey, when mixed in equal quantity, it makes toxicity. So, like that, it's not ghee is good, honey is good, but when you are mixed in the same quantity, it is not good. So it depends upon how you make a medicine, and what Acharya or the Gurus make the like that, it will be good for body and mind. All the body. Even though a kashaya can be taken for long period, it will not give any side effect. That is why yoga, many medicines mixing gives relief from the side effects. By one medicine will give side effect. When you mix with many medicines, it will not give side effect. For that only they are doing yogas. Yoga, many drugs are mixed and giving. Even though you take it daily, no problem. So that is the concept of Ayurveda. So they classify into Samudaya Prabhava means combination. Samudaya combination. Avayava means each one, each of the drugs. That's different. So we have to find out how a medicine is made. So I used to take a class what is the science behind making a medicine. How we can make a medicine. I used to take. So this also we should know. And Acharya Charaka tells about 50 kashayas, 50 type of kashayas, yoga. And after everything, describing everything, he tells, these 50 kashayas you can use if you don't have the knowledge of the drugs properly. I have told you this can be given in this condition, you will get this. One who has more intellect, he can make his own yogas. Those who have no intellect, they can follow one another. So you can, as a physician, with your intellect, make your, as already Triphala is told, you can add something else. You can make it with formula. Formula you can make, and it can be, and when one yoga is given, you can take out one medicine which is not good for one patient and mix some other things. It is done in the Ayurveda Shala. Some of the drugs, they will change because it will not be suitable for one patient. So, you have got to find out what the Ayurvedic qualities, medicinal values we can find out. Otherwise, if it's a gradual business. For the time being, we can have some medicines from Kerala or India, simple medicines which can be used in the conditions of disease. We will have a knowledge about that. You just find out what are the diseases coming across, and we shall prescribe some of the Vata, Pitta, Kapha conditions of each disease. This can be utilized.
I've brought some herbs from Germany as a seed. I can give it to you, but fennel, you know, it's all it's growing here in India too. So fennel, jeera.
Fennel, it's
dill, weiß ich nicht, dill.
Fennel is here.
Yeah, it's at home. Camomilla, Camilla. Camomilla. I don't know if it's growing.
And I will be coming to Germany in April.
Yeah. Okay.
I will be taking class in Duisburg University, and class is arranged. So I will be coming there. So I wanted to discuss with the Shyar also about this, how these Ayurvedic principles can be utilized in the way of the herbs grown in Germany. We have to find out and have a study. Then it will be very good. Ayurveda is not medicine. Ayurveda is a principle. And from starting of the Ayurveda, there is a story that Atreya was the first physician described in the Ayurvedic classic. He went to paradise and studied this Ayurvedic knowledge from the king of the paradise called Indra, and thereby Ayurveda came to this. This is a story, it's a mythology. that shows that what he studied was the principles of Ayurveda, not the medicine. So, if you are using the herbs in Germany, that's not described in Ayurvedic classics. Still, if you are using the principles of Ayurveda, it is Ayurveda. It is Ayurveda. You need not use Vacha or Dasna. You can use any other drug. You have to, the principle should be followed by the Ayurveda. You can take any drug. This may be sometimes a medicine. You have to find out what the qualities, Rasa, Virya, Vibhaga, Prabhava, and what are the effects of in the doshas. This is a new drug. You can utilize it. This is it. The dosha principle you have to follow, then it is Ayurveda. And Panchabhuta principle. Is it? Am I correct? So you can utilize the drugs grown in Germany itself. No problem. You need not import all the drugs from Kerala, India. But India's for medicinal medicines available in India is too much. Herbs are very much, not in other countries. We have many mountains, etc. and many medicines are different variety of medicines are available. My friend, he has got a herbarium of 50,000 medicines in India. 50,000. In Bangalore, if you are available, we shall find it. He has kept 50,000 medicines, medicinal value plants, herbarium. There is no other area it is available. So we have abundant knowledge of medicines and also qualities, but in Germany you have to develop this knowledge. What are the plants available? How it can be utilized in the Ayurvedic way? That you can think over it. With the help of Shalakumar, you can think over it. So, okay.
Thank you very much. Thank you.
Immense freedom. Immense freedom to make a medicine and give it to the patient. Because immense conditions are there in the patient. Immense conditions are there in the medicine and suitable you can use it. Am I correct? What do you say?
Okay, very good.
So then we can classify